Are you hearing all the buzz about telemedicine? If so, TreatMD is proud to present why and how to implement telemedicine inside your practice. So let's begin with the whys. So number 1 on the list, retention. Practices are constantly losing patients in today's on-demand world. How many times do patients get frustrated with an illness or condition where they can't see their doctor for a week or even 2? Now there's a very high chance the same patient will go to another provider that he searched online the very same day. The originating practice in turn loses the patient. What if, while you're on the phone with the patient, a receptionist or an assistant could have said, "We can see you next week, but we do have a telemedicine session opening in 2 hours to discuss and evaluate your condition." Why not treat ultimately save the patient and also provide an experience that the patient will value and probably refer to others? Number 2 on the list, turning on after hours. There's much to be said about using telemedicine for after-hours care. Not only does it allow practices to extend office hours without extra overhead, but it brings additional revenue to a practice. It can also allow your practice to effectively triage after-hour patient calls and schedule them for the next day appointments rather than referring them to an urgent care or emergency room. Urgent care clinics are going after your patients as well these days, and they prey on after-hour patients. Telemedicine can enable you to actually compete against both retail clinics and urgent care. Number 3 on the list, patient satisfaction. Your patients will love the convenience of being able to handle medical issues, possibly upper respiratory conditions, flu-like symptoms, follow-up procedures, or minor infections without ever having to make an appointment to come in and see you. Patients love using telemedicine. It's convenient, easy, and saves them a lot of time. Satisfaction scores are generally reported to be around 75 to 90%, and telemedicine no-show rates for institutions were documented to be as low as 7 to 10% 1 year. It also creates flexibility for demanding schedules that we all face. Consider the hectic lives that many of our patients lead. Some have restrictive work schedules, some are balancing childcare, the care of other family members, while others have chronic illnesses or are juggling multiple doctor appointments. Patients appreciate any step that we can take to make their lives easier and facilitate their care while acknowledging the hectic lives we all live in today's demanding world. Telemedicine is one of the fastest growing verticals in healthcare, and it's making significant advancements. A question asked frequently is, can I bill or submit a claim for telemedicine consultation? The answer is yes. Many states have introduced telemedicine parity legislation, including bills permitting coverage for private insurance, Medicaid, Medicare, and state employee health plans. Number 5 on the list, follow-up appointments. How many patients after feeling better actually go to follow-ups? We make it very easy to schedule a follow-up appointment with your patients. We also make it very easy to empower assistants, administrators, and other employees of the practice to conduct follow-up appointments with your patients. Number 6 on the list, reduce the no-shows. Do you struggle with no-shows or cancellations? The average practice typically has a 5 to 10% no-show rate. While that may not sound like much, it can be costing your practice thousands each year in lost revenue. What if your practice performed an end-of-the-day reconciliation of all your no-shows to try and save that patient by conducting a telemedicine visit right there and then? While you certainly cannot prevent all no-shows, giving your patients a convenient way to get care eliminates a lot of the variables that can lead to missed appointments. Traffic on the way to the office, or not being able to get away from demanding schedules. When you offer your patients an alternative way to see you, your no-shows are now manageable and retention increases. Number 7 on the list, breaking geographical boundaries. Did you know over half of all U.S. hospitals now use some form of telemedicine, increasing communication with suburban and rural clinics, which in turn grants health access to a wider variety of people? It also provides an opportunity for expansion of physician practices. Practices cannot treat and manage patients that were not once able to travel to a practice, or even treat a patient in another state or country. Number 8 on the list, attracting new patients. In a recent survey, 75% of patients said they were interested in doing a telemedicine visit for minor ailments. This was especially true for urgent issues that needed quick treatments. Adding telemedicine to your practice is a way to answer that demand and attract new patients who are looking for that convenience. Patients will appreciate the fact that you offer accessible care and may even be willing to pay more for the service. Number 9 on the list, conduct same-day appointments. When you have a way to offer virtual visits, same-day appointments are easier to accommodate. Just queue up the patient on your on-demand list and notify them when a time slot opens up between appointments. The patient can simply go online and see you in minutes instead of waiting around in your office all day or heading off to the nearest urgent care center. Number 10 on the list, monitor your patients. We have integrated dozens of remote monitoring devices for patients to utilize, such as weight scales, glucose meters, blood pressure devices, and COP devices, and many more to remotely monitor from the TreatMD platform. Many new CPT codes from remote chronic care and remote monitoring are available to even add more revenue streams to your practice. Which leads us to increasing your revenues. Believe it or not, so far, every reason why to launch telemedicine increases a practice revenues and efficiency. A well-run telemedicine practice not only increases revenues, but makes your practice more efficient and provides your patients with a positive experience. But it sets your practice up for the growing demand today. So let's talk on how to launch telemedicine. Signing up is easy and free. We offer a 30-day free trial, and if you like it, we have practice packages starting at $99 a month. All you need is an internet connection, a camera, permission sets for employees to start managing patients. Don't be worried, we also walk you through the entire process. If you don't have a camera, we will even send you one. There's a myth that doctors are the only ones that can conduct telemedicine services. This thought process sometimes makes doctors feel that they don't have the time or capacity to add telemedicine to their practice. This is why we added the ability to add and set permissions on assistants, nurses, administrators, and billers to spread the roles of telemedicine within your practice. A big feature of TreatMD is that we offer a real white label platform solution for your practice. Your logo, your colors, your domain name, most important, your practice. Your patients can go to doctors.yourdomain.com and start booking a telemedicine or in-office appointment within your practice. Unification of personal health records or general medical data is a tough feat in our healthcare ecosystem. TreatMD has integrated with top EHR vendors and continues to advance our integration. We can work with your EHR vendor to make patient charts and patient data integrated with your TreatMD platform and vice versa. Whether you're deciding to offer telemedicine as a means for patient retention, to enhance patient experience and care, or increase practice revenue, we've created a turnkey solution for your practice and will be right there next to you every step of the way to launch telemedicine in your practice.